Welcome to Prepare to Care, an AARP caregiving podcast aimed at bringing you free information, resources, and tools to help support you and your family in your caregiving journey. I am your host, Charlene James. Thank you for joining us. Millions of Americans between the ages of 50 and 64 will be able to sign up for health insurance through the Health Insurance Marketplace until August 15th. Many of those applying may qualify for increased financial assistance to help with the premiums included in the Americans Rescue Plan. Here to talk to us today about this extension and what it may mean for you is Ms. Jeness Sherrell, Adult Services Director with Change Happens. Jeness, thank you for joining us.
Thank you very much for having me.
Texans who have lost insurance during the pandemic or have been unable to pay the coverage in the past have a chance to ask or seek coverage through the extension. What does this mean? And explain to us who is eligible for this coverage.
So, first of all, what this means is that more people have an opportunity to apply for health insurance through the federal marketplace. Typically, the marketplace is only open for open enrollment for 45 days, which is November 1st through December 15th. Mm-hmm. As you know, we're well beyond that time right now. And so this particular year, particularly due to the pandemic, we experienced an opportunity for the marketplace to be reopened. And so to give people an opportunity to go in and apply for health insurance. That means that millions of people who did not get a chance for some reason to apply during the regular open enrollment season now have an opportunity to go in and apply. This also means that if someone perhaps didn't qualify before, perhaps they didn't have a job, or they had a job, they may have had employer-sponsored insurance, and now they find that they don't. And so this is an opportunity for them to get a qualified health plan through the federal marketplace.
Okay, well, it's glad to hear that it's been extended so that opportunity is available. So tell us, what kind of insurance coverage can people get?
So we are talking about private health insurance, a qualified health plan. These plans actually all have to meet what's called the 10 essential services. So that means pregnancy is covered, mental health is covered, prescriptions. It means that people are able to get things like if they have rehabilitative services. And so all of these things are covered, laboratory. So these are insurance. And I think a lot of people feel like, oh, this isn't real insurance, or it doesn't cover everything. It is all encompassing private health insurance.
Okay. And does it also include the ages of your children up to what? 26? Right, yeah.
Yes,
so that's good for the college kids.
Exactly. Exactly. Yeah. Most definitely. And so
go ahead.
Go ahead.
No, I was just going to ask you, so what do people have to do? What are the steps they need to take?
So the main thing is to apply. And so, a lot of people will say, well, I heard that it's this, or I don't know if I qualify. The way that you find out is you can go to the Marketplace website, which is healthcare.gov. Okay. And there's screening tools available. So just in case if someone wants to see, okay, this is how much I make, this is how many people I have in my household. what type of insurance could we get and how much would it cost? So they're able to do that without actually completing an application. But if you
Okay.
know
Okay.
I know I'm ready to get this insurance, then you can complete an application. You can do it online, you can do it over the phone, or you can meet with someone such as a navigator from Change Happens. We have navigators that are
Okay.
available to assist people with completing an application. These navigators also can help and navigate them through this system and help them to understand the different plans and the different information about co-insurance and deductibles and things like that. So that navigator can navigate this entire insurance system with with the consumer and help them to understand.
Okay. And it also will help specify if you are applying for coverage in Texas, right?
Correct. Correct.
Okay.
Yes.
Okay.
So
Yeah.
for our navigators, we're located physically
Okay.
in Houston, but we provide services across a number of counties throughout the state of Texas. But I will tell you, we have a no wrong door policy. So we
Good.
have people that contact us from Arkansas and
Okay.
Oklahoma and
Okay.
Louisiana, and so we're going to provide services regardless. But for Texans, we're familiar with the insurance plans that are available here.
Hmm.
And so the navigators are able to answer questions and
Hmm.
assist the consumers. They may have particular needs. They may have specialists that they already have, and they want to ensure that they can stay with those specialists or be able to continue to go to a particular hospital. And so the navigator is able to help that client to make sure that the insurance plan that they choose also is already within the network of that particular doctor or
Okay.
specialist or that particular hospital.
Okay. Now, on this podcast, we're always trying to provide additional information and resources for caregivers. So, is there any special information or advice you can give caregivers who would be interested in this coverage?
So, our thing is self-care is a big phrase that's going around a
Right.
lot right now. And, caregivers work a lot to make sure that those people that they're taking care of have their doctor's appointments and are able to
Hmm.
get their prescriptions filled. But oftentimes the caregivers forget about themselves.
So
And
true.
so our main thing that we want to say to caregivers is make sure that you're covered as well. Make sure that you have health insurance. And, we have folks who say, well, but I'm only receiving unemployment. I don't have any income. Now is the time to look and see what's available out there.
Hmm.
Because of changes that have been made by our current administration, um, our president wants to ensure that no one is going uninsured. And so,
That's true.
if you've received unemployment benefits at any point during this pandemic season, then again, it's very important that you look and see about getting health insurance. And so we just want to make sure that everyone is taking care of themselves, and that's caregivers
Hmm.
as well. It's important that you ensure that you have health coverage and that you're taking care of yourself before you're seeing to others.
Okay. And I think the important thing that you said is that there's no wrong door.
Yes.
That when people access and use the number that you've provided, that don't be afraid to ask the questions. You may think that your question is, oh, that's such a silly question, but don't be afraid to ask because we want to make sure that everyone has appropriate coverage so that they can take care of themselves and their health and well-being. So, is there one last piece of advice you'd like to give to our listeners in terms of the marketplace and the procedures for accessing coverage opportunities?
So really just to kind of piggyback on what you just said is that we definitely want to make sure people understand that the only wrong question is the one that you don't ask. And so we are here and we're available to help consumers, to help them to navigate this process. There are some people that have never had health insurance, or they've only had employer sponsored insurance. And so they never had to make any choices or decisions when it came to health insurance. And so they may not understand the different things that you should be looking for when you're looking to sign up for health insurance. And so that's why we feel it's important to speak to a navigator, because we actually have the expertise to be able to assist with those things. And so we have staff that's available. We have bilingual navigators available as well that can help you to understand what's this health insurance, what's involved, what's the benefit, how much it's going to cost you, and what type of documents you need, who's eligible, who's not. So we're available to be able to help with that. And again, we're encouraging everyone to take advantage of this open enrollment. After August the 15th, open enrollment won't be again until November 1st. And so, and what that means is to be able to get insurance, to be able to make changes to your current insurance, you would have to have what's called a life change. You know, you moved, got married, had a baby, someone passed away. It has to be something like that to be able to qualify for a special enrollment period. But right now, there's no requirements for a special enrollment period because it's open enrollment. And so we can't stress enough how important it is to take advantage of enrolling during this open enrollment season because it won't be again until November 1st.
Say that again. This is your opportunity. This is your opportunity. Yes.
Exactly.
That's exactly right.
And I think you know, we run across people all the time. They go on vacation and break a leg, or they, you know, get sick or in a car accident or anything like that. You know, unfortunately, we have people who feel like health insurance is something I don't really need because I'm pretty healthy, you know. However, it just takes one thing, one medical emergency to ruin a family financially. And it doesn't have to be that way. It really makes a difference when you have health coverage. And so also having health coverage, there's preventive stuff that could be done. Right. You know, people are more likely to go and get physicals, get a checkup. And again, we find our caregivers, they will make sure that their children have health insurance.
Everybody else.
Sure their parents have health insurance, and then they don't have health insurance. And so we can't stress it enough that we want to make sure that everyone is covered. Everyone has
everyone, all ages.
All ages.
All
exactly. Exactly. Health insurance is not just for children and the elderly. It's for everyone.
It's for everyone. Well, thank you so much, Jeness, for joining us today. Really valuable information, and we certainly hope that people will access what is available. Thank you, and continue to be well.
Thank you. Same to you.
Okay. Well, go to aarp.org Houston to register for our AARP Texas on July 29th at 6:10 p.m. There you can register to ask questions and find out how you could save money by taking advantage of the special enrollment period. We encourage you to follow the Prepare to Care podcast at aarp.org/Houston PTC. You can also catch episodes of our AARP Texas YouTube channel. Thanks for listening, and as always, thanks for caring.